10,000 people in Michigan living with epilepsy, but there are treatments that can make patients seizure-free or significantly decrease the number of seizures they have and the number of medications that they have to take.
Our Alyssa Heron shares the newest options available at Spectrum Health in this week's Medical Moment.
So epilepsy is a neurological condition where people are prone to having recurrent seizures that happen without any provocation. So seizures themselves happen when neurons in the brain fire out of control. That abnormal neuron firing can cause symptoms as mild as just an abnormal sensation, or can cause, up to the most severe grand mal seizures with generalized shaking and loss of consciousness.
Dr. Rachel Fabris with Spectrum Health says seizures themselves are very common. In fact, 1 in 26 people will develop epilepsy at some point in their life.
Unfortunately, there's no real cure for epilepsy.
But there are a variety of medications, and they're the main form of treatment to control epilepsy and help people live normal lives without any specific limitations. However, Dr. Fabris says for about a third of people, medications aren't effective. So they turn to other forms of treatment that can be used in kids and adults.
People with all different forms of epilepsy can be candidates for epilepsy surgery. A lot of times when we're thinking about epilepsy surgery, we're specifically targeting people who have focal seizures or seizures that start in one area of the brain.
And while there are several effective surgeries, Spectrum Health is now home to the newest technology called
It's called a MEG scan or a magnetoencephalography, MEG.
And it's the only one in West Michigan.
The MEG scan combines MRI and EEG. The EEG picks up electrical signals in one way, and the MEG picks up electrical signals in another way. And the MEG really helps us to identify abnormal electrical activity in the brain that the EEG doesn't pick up. And it can help us to identify a particular area in the brain that is abnormal, but we're not seeing that abnormality on any other testing that we do.
As you can see, the patient comes in a room and once they're hooked up, lie down with the MEG scan going around their head and taking pictures of their brain.
And we also have the opportunity to map certain functions with the MEG scan so we can see where in the brain their language is located and where their visual function is and where their motor and sensory functions are. And that really helps us also in planning epilepsy surgery.
In Grand Rapids, Alyssa Heron, Fox 17 News.
For more information on epilepsy and treatments available at Spectrum Health, you can visit spectrumhealth.org/epilepsy.